How do we make customers happy in healthcare? It's sort of an age-old question. I don't personally think the formula's changed all that much. I think the danger is when we think people in healthcare, the customers want something different, different from what they've always wanted or expected in the past. I mean, healthcare is a very personal product. It's the healthcare system is a service-based industry. We're providing a service to people, a service that comes for many people at a highly charged, vulnerable moment in their lives, whether it's themselves or their family members that are sick or need care. So in that situation, what the customer wants is really, things like to be listened to be able to articulate their concerns or problems to the professional on the other end of the desk or in the exam room, to be able to have someone competent in front of them who's going to give them a plan of action for either how to treat their disease or how to help diagnose what they feel is wrong with them. So, qualities like trust, qualities like empathy, qualities like the ability to listen carefully, understand the patient. These are the expectations that I think people who engage in the healthcare system as customers want. I don't think it's any different from what our parents wanted or their parents wanted out of healthcare. It's very different in some ways from other industries. And so we have to appreciate that the formula still kind of remains the same. Now that said, the other thing that the customer wants is to be able to have a seamless transaction. So, and this is something healthcare needs to learn how to do better, particularly with so many new insured individuals that are about to come into the system. They want, a doctor's visit shouldn't have to take 2.5 hours out of someone's workday. And yet we have many situations in healthcare where, we expect poor service. We expect when we go to visit the doctor that it's going to take a half a day. And the industry and the system really needs to rethink that, because no customer, if you went into a coffee shop, you wouldn't expect to wait, 45 minutes for a cup of coffee. It's no different in healthcare. So I think increasing the expectation of faster service, more seamless service in terms of moving the patient around in the system to the extent they need to get services. We need to do that much better because the customer expects that, because in every other walk of life, increasingly, we are in a world where transactions move faster, and so healthcare really has to abide by the same principles.